Committee expected out tomorrow. A bipartisan group of senators in the Senate Finance Committee has been working on a bill for months. Chairman Max Baucus says he hopes Republicans are with him. New polls out show Americans do as well. Most Americans think President Obama and congressional Democrats should adjust the health care bill to bring more Republicans on board. Another poll says Americans remain almost deadlocked on overhauling the nation's health care system. 46% in favor of the proposed changes, 48% opposed. But the government-run insurance option has become the major point of contention. Without it, 50% of Americans back the rest of the proposed bill, but a still sizable 42% opposes health care reform, with or without the public option. Joining us now from Capitol Hill, Republican Senator Orrin Hatch of Utah. Senator, good afternoon to you. Thanks for joining us.
Well, glad to be with you.
You have said on Fox News Sunday that you don't see Republican support for the bill that you think is going to come out of Max Baucus's committee, correct?
Well, that's right. You know, if anyone thinks that Washington, and let me repeat, Washington can come up with $1 trillion bill, ensure everybody in America, not reduce the deficit, and of course not reduce benefits, and do it all in a way that will meet budgetary standards, then I got a bridge to sell you. The fact of the matter is that the way they're doing this is just more and more taxes, and look, you either got to increase taxes or you got to cut back benefits to resolve these problems. And what they're doing is they're increasing taxes, they're not cutting back benefits, and frankly, they're trying to put through a government plan, one way or the other, that will have everything run right out of Washington. I mean, look, it just doesn't work that way.
Well, you might want to sell that bridge to President Obama, because he said in his big speech that this is not going to increase the deficit by one dime.
Well, already, you know, the House bill, for instance, is $250 million short. If Senator Baucus, who I admire, who I think has really tried his dead level best to try and come up with something that will please the administration and everybody else, but he can't the way they're doing it, because it means more Washington, more taxes, more expenditures, less care, and even excise taxes on medical device manufacturers and others. Everything from CAT scans to Q-tips, they're trying to tax, and in the end, guess who pays for all that? We all do. Then Senator Baucus, in order to pay for this, because the CBO will not give enough revenues unless they have an employer mandate. That just absolutely kills people on the lower income level. They'll either lose their jobs, the company's going to move overseas, or they'll cut back on their pay. And then they want an employee mandate. That means if you're owning over $66,000 a year and you don't have health care, you're going to get socked $3,800. And of course, that's what it'll be tomorrow, but the next day it'll be even more. Well, so these are the type of ideas that they're coming up with in this administration, and they're just wrong.
Here's what I don't understand. The president basically says the sky is falling because of health care. We got to pass this bill right away because it's wrecking the American economy. Thomas Sowell pointed out in a column last week that none of these changes would take effect until 2013, which it just so happens is the year after Mr. Obama would have run for re-election. What do you make of that?
Well, Senator Baucus said that his bill is $890 billion. Well, it isn't, because it doesn't really fully come into effect until 2013. If you put a full 10-year measure on it, it's $1.5 trillion to $2 trillion. That's on top of the $2.4 trillion we're already spending on health care in our country. Look, our country can't afford that. We've got to, and you know, we could solve every one of these problems if we would block grant monies to the states in accordance with population, and let the states solve their own problems within their own demographics. Now, admittedly, some large Democrat states will never live within their means. They want the federal government to bail them out. And so all of the other states that are doing a good job have got to help pay for the states that aren't doing a good job. And that's just not the way to go. And that's why we have federalism. You would have 50 state laboratories, so everybody could look at every other state and see what works and what doesn't. And in the end, we would have a health care system that would at least have a future that might save us money, work better, and of course help American people.
I would love to talk health care with you for another hour, Senator, but we have to say goodbye. Thanks for joining us.
Okay.